it. So when it comes to health and wellness, we're not just listening to your symptoms. We're going to evaluate your health and figure out where is the body breaking down. Where's that little splinter that is a burr in your saddle or, messing up your health? And if we can get that out of the way, you're going to feel a change. You're going to feel a shift in how your body is performing. Well, hello, everybody. Dr. Aaron Chapa here on the Dr. Chapa Wellness Show. So guess what? That means you're about to be healthier, stronger, and better for tuning in. So we're excited to have you tune in. We're excited to share a message with you today on how to live your best life and be your best through food. The power of food is everything. It is medicine. And on the Dr. Chapa Wellness Show, we want to help you, your friends, family, and loved ones live their best life, full of energy, full of vibrancy, full of longevity, to fill their life up with all the awesome that God has in store. So we are glad you're tuning in. We're glad you're here. Today we're going to be working through the concept of root cause medicine. That is functional medicine. What is it? Many people have no idea. They've never even heard the term. And so we're going to educate you about the different philosophies that we are exposed to here in the Western world. And so we are excited to just bring a message of hope and healing to you. So stay tuned as we dial into this podcast today and teach you what you need to know about how to take the bull by the horns and get to the root of all your symptom patterns. And remember, if you have symptom patterns that you were not genetically born with, guess what? There's a fix for it. If you can develop it, you can undevelop it. And we want people to realize you're not stuck with symptoms if you don't want to be. There are things that you can do right now to make change, either through your mindset, through your lifestyle, through your sleep patterns, through the way you eat, through the way that way you think, in order to feel better and live better without symptoms and without the diagnosis. And so we are in the world today to teach people to function better without drugs and without surgery. So I wanted to talk a little bit about allopathic medicine. That's the traditional, you have an ail and we're going to give you a pill for that ail, and we call it, giving pills for ails. And so we want to teach people that Western medicine gives drugs. Drugs are not the answer all the time. And so we want to show people a different way. And so treating symptoms just because we have a quote-unquote drug is not necessarily wellness, is not at all the life that we want to teach you. I want to see you live a drug-free life, one where you're free of antibiotics, one that's free of steroids, one that's free of surgery if possible. I mean, I understand injuries happen and things go down, and we have experienced that personally in our family. And it is not always easy to make those decisions whenever you're a little bit dogmatic about your approach. But being where I'm at today, I'm very thankful that from 18, 15, 13, and 8 years old, my wife and I, all of us, we have never been on antibiotics or steroids. And I'm not saying, pat myself on the back, look at me, I'm such a great guy. I'm looking at it from a perspective of root cause medicine. When a fever pops up, I don't panic and shut the fever off with a drug. When a sore throat happens or tonsils swell, I don't get panicked and go, oh my gosh, I need to get them on an antibiotic because they could die. I don't have that extreme mindset that many people that I meet and deal with day in and day out have in the beginning. It is an absolute pleasure and a joy to teach people how to not use antibiotics and still get the result, trusting that God designed the body to heal and the body wants to be well and over a bug of sorts and symptoms that come with bugs. So if you have fevers, if you have chills, if you got flu-like symptoms, you don't necessarily need to do anything about it. It may be self-limiting. It may be you need some herbs. It may be you need some rest. It may be you need to do some Epsom salt baths. There's so many endless hacks that you can do to take care of your own health at home, take care of your family's health at home, and never put them on around medications. And in our house, we have a little mantra that says, when in doubt, we congoplex it out. We have supplements that stimulate the brain, the immune system, the gut lining, and the fundamental mineral base basis that will knock out infections whenever they pop up. So, the question people ask all the time, well, I mean, how do you know it works? Well, I've seen it work thousands of times. So my practice now has shown me. In the beginning, I borrowed testimonies and confidence of others. So have you ever heard of the mindset, standing on the shoulders of giants? So you are probably where you are because there are people that have gone before you that have done great things in your field, and you're modeling your life after aspects of theirs in order to become like them, successful and dynamic and set apart for the mission that God's put you on. And so, but if you're sick all the time and you have symptoms all the time, blood pressure, for example, the answer isn't put another blood pressure medication. The average American that's in their late 30s, early 40s is on 3 to 5 medications today. And we are currently, sitting in 2024. And so with that as a stat, we go, well, why? And why are they on multiple blood pressure medications? And the answer is because if one's not enough, I mean, essentially, let's give them another, and we don't take them off the old. We want to support, is it a calcium channel blocker or is it a beta blocker? And we're going to use the different things that we know about physiology to turn off things. See, drugs force the body into suppression or force the body to a task. Forcing the body doesn't serve the body. And so we all have heard people that take steroids, for example, to get muscular. They lose their production sites for the hormone testosterone, and they wind up causing atrophy to their testosterone generators. Well, it's the same thing when it comes to the use of antibiotics or the use of steroids. And I remember my wife and I being, in college still, talking to a buddy of mine, and he was teaching her about what an antibiotic is. An antibiotic is anti-life. And anti-life basically means that the system is going to be exposed to something that is anti-life. That means any good flora you have in your system is that is alive can be potentially damaged by this anti-life drug called an antibiotic. And people might go, well, Dr. Chapa, that's a little extreme. Maybe. I've sat in seminars where pharmacists would stand up and say something to the effect that they are pharmacists. This one guy was a research drug expert for a major pharma company, and he said that of all the drugs that he's proud of making, the one drug that he has made and would never take was an antibiotic. Because when you destroy the body with medication, sometimes it's destruction and it's irreparable. So I look at antibiotics like 9 lives of a cat. And when that's the only methodology in the West to give at the sign of a cold or a bug, I think we're heavily overutilizing the medications that should be used for life-threatening situations. And we need to be bolstering and strengthening and building the body up and finding why the body's breaking down. And that's root cause medicine. That is essentially what functional medicine is. So when we do functional medicine and we are taking people, their health, we are looking at exercise and lifestyle. I'll say on that note, exercise gives you bandwidth and bandwidth to make mistakes in your diet. Exercise will allow blood flow to improve and get to areas of the body that may be not as quality blood flow now because you're stagnant. Sitting, for example, is the new smoking. So if I'm not up and moving, the dude don't move, the dude don't groove. We get in trouble. And so sitting being the new smoking, you've got to find ways in your day to get up and move and groove and be alive and well, not just sitting in this, a posture where we can get stagnant, because we don't want our body blood flow wise to slow down. And so we use stress management practice. So we have to help people with breathing. I remember this one patient came in, tons of anxiety, and we taught her a technique. There's a great app that I use called the Tactical Breather app. It's a free app, and it just teaches you to do block breathing. 4 seconds in, 4 seconds out, 4-second hold on both sides. So you would inhale. So you can practice it with me. Take 4 seconds. We're just going to breathe in. You're going to go hold, and then we're going to exhale, hold, and that's it. You repeat that for 2 minutes. That's a practice that allows you to bring diaphragmatic breathing into the picture, diaphragmatic being lower lung pulls, because most stressed out people are upper respiratory, shallow breathers, high acidity breathers is what we call them. And high acidity is inflammation, right? So diaphragmatic breathing, deep breathing exercises is a way that you can rest and digest, heal and repair, shift your body from stress management to relaxation through a system of the body called the parasympathetic nervous system. And so when we work with patients, we are looking at something as simple as 2-minute breathing exercises 2 to 3 times a day. We're looking at herbal intervention to do stress management. I would say that's probably a large part of the practice, because most people coming in today, whether they're stressed about their health, whether they're stressed about their family, whether they're stressed about their wealth, whether they're stressed about their, their job, their career, their relationships, it doesn't matter. The stresses are real, and we've got to make sure that when you are running high stress, that you're not constantly tearing your body apart with these high hormone cortisol levels that degenerate and denature the cell structure in the body. And so that being said, when we come alongside people, we don't just listen for symptoms that they're having, we also analyze their blood work. And so we take blood analysis from people, a very complex profile where we look at minerals, we look at essential fats, we look at triglycerides, cholesterol, we look at inflammatory markers, we look at liver markers, we look at different aspects of electrolytes, thyroid and adrenal and other joint modulatory ones and immune ones to help us see if there's infection, what type of infection. And although we don't always know exactly off a blood panel where an infection is, we can see clearly that there's an infection. But do we really even care where the infection is? No. If you've got a skin infection, well, you might see that one. But if you had some infection in the liver or the lymph nodes, well, we just want to support the body's immunity and trust the body to do the job. Remember, you can never be wrong with nutrition, guys. You can only be more right. So when we come in, we might bolster and strengthen the immune system by stimulating your T cells or your white blood cell production sites from your bone marrow or from even the gut, your nervous system. We might load you up on calcium and magnesium with the intent that your body knows how to manage immunity better than you do. So dropping an anti-life pill in the conversation isn't the answer. We want to train the body like going to the gym, the immune system to go and fight when it's exposed. If you keep leaning into the meds, the Western way, and treating allopathically, when you have a symptom, here's a pill for an ill, we want to you're going to sabotage or atrophy your own body's ability to recover and repair. You're going to sabotage your immune system. So when you are exposed to a real bug, you are now fighting harder, triple time than you need to because you never trained well. It'd be like me going and running a marathon and not training. That would just not be a smart decision. Now, what is interesting about functional medicine is people come in and we don't just look at blood work and symptoms, but we're also listening to hormone stories and we're doing stool analysis. We're looking at the body as a watch. Which part of your watch tells time? All of it. And so the same with mine, and the body is the same way. The problem with the Western way, the allopathic way, is a cardiologist has gotten so focused on just cardiology that they don't really incorporate the aspects of the brain. They send that over to their brain buddy, and he's the neuro guy. And the neuro guy sends to the kidney guy, the renal specialist, and the renal guy sends to the pulmonologist, the lung guy, and the ENT guy gets in his hands in when there's sinus issues. And so it's so specialized that they don't know what each other's doing because they're seeing so many people in the symptomatic way. But a functional practitioner will come in and look at the body and figure out where are the predominant symptoms presenting themselves. What does the blood say about acidity? What does the blood say about infection? What does the blood say about deficiency? What does the blood say about congestion? What does the stool test say about the gut microbiome, the brain-gut connection, the health of the gut lining, the enzyme productivity? And when you start looking at the body at this angle, you start seeing, oh, well, there's the issue and there's the issue. And we can start hyper-focusing on certain areas of the body with herbs, with nutrients, with lifestyle. And that's where we shine in the functional medicine world, in a world that needs to wake up and realize that medications are overused and over consumed, and they're creating more deficit in the body than they are benefit. And so I want to just encourage everybody to think about that from a perspective of more than prevention. It becomes a wellness journey, because now you're starting to see that how you feel every day matters. So if you take, for example, your stress, and your stress is on a 0 to 10 scale, 7 being the high point, 10 being the highest. 7 to a 10 stress level indicates that there is things that you need to be dealing with today. You're in what we call a hot sympathetic overload fight or flight response time. Well, if you're just there for an afternoon because you got caught in bad traffic, a bad phone call, and a bad day at work, but you're able to recover from it well, that's okay. But if you're waking up in a 7, if you're living your day at an 8, if you're coming home at a 9, and then every now and again you have a blow up and you're at a 9.5, 10, guess what? That is a problem. And if you run at that hot level of stress, 0 to 10, 7 to a 10 zone all the time, you're potentially developing ulcers. You're potentially tearing your body down immunologically. High stress environments weaken your immune system. So a lot of your reoccurring infections are absolutely because you're stressed out. So we want to help you see that stress management matters, and you assessing that stress is something that you can deal with functional medicine practice, and you learning to read the signs. Which then takes me into what I call transformational medicine. Transformational medicine is taking you out of just symptom land and where you're dealing with your allergies or dealing with your sleep issue, and now all of a sudden we are not just turning over the stones using functional practice, which is blood work, stool tests, different types of therapies that we would run throughout the year as maintenance. You are now transforming into a advocate to others around you. You are a light in a dark place. You are an encouragement in a world that needs hope and needs fulfillment and needs purpose. You become an advocate for blooming where you're planted, and now transforming into a generation jumper where you're not going to have the ailments that your mom and dad had. You're not going to want. You don't even care to blame them for the high cholesterol, the heart issues, the cancer that's in the gene code. It is what it is. You're going to be living such a life transformatively that your body never expresses your genotype of the past, the generational upline, so to speak, from mom and dad. And so if you have cancer in your gene pool, if you've got high cardiovascular disease in your gene pool, if you've got whatever in your gene pool, that's just a blueprint that could be followed. But your body phenotypically expresses a different aspect of that blueprint according to your lifestyle. So essentially, your lifestyle becomes the transformation into a better version of yourself, expressing healthy genes that suppress the bad cancer genes or the cardiovascular genes or the syndrome X genes or whatever the blood sugar issues may be, genes that are out of balance and keeping you in balance. And you are now falling in love with feeling good. And again, there's nothing that feels better than feeling good. Waking up with headaches is no fun. Going to bed stressed is no fun. Having an ulcer is no fun. Being worried how you're going to get to the next stop because of your bowel issues, very much no fun. These people come in all the time, and we are here to help them and serve them in ways that they wouldn't otherwise have access to if we didn't teach them these practices. So transformation medicine then becomes an opportunity for you to share your stories with others and make a difference in kids' lives, your generational lives below you, and basically recapturing 2 generations of health. So when people come in sick and tired and broken down, they might not realize that I had a 20, I think she was 23, 23-year-old come in recently, and palpitations, anxiety, and she's very worked up, stressed out worried about everything. And we sat down and we went through her case. We looked at the blood work that the hospital had run because she had to go in there for panic attacks. They had no answers. Their only answer was Prozac. And it's just interesting. Like, we reached to extreme drugs first instead of lifestyle practice first. And again, that's where I want you guys to know that when you're listening to this show, we're going to try to teach you the ways of living your best. And this gal, we supported her adrenal glands. We got her some minerals. We got her sleeping better. And inside of 2 weeks, she had 0 pressure in her head, pressure in her stomach, and the anxiety was gone. Now, she was still having a little bit of issue, but that is just time in the saddle. She has to stay with the program long enough in order to feel her best, live her best. So you can't expect, and this is the illusion of medicine, that once they drop the drug on there that your symptoms are obliterated. No, they've just been suppressed. It's like taking the check engine light and just, smashing the bulb in the light and causing you to not have a dashboard light on anymore. That is not fixing anything. So drugs essentially do not fix problems, they manage problems. And they manage one problem, leads to a new problem, pops up, and they manage that problem. The next thing you know, you're that person that's in your late 30s, early 40s on 3 to 5 medications. Well, it's time to make a shift, guys. It's time to shift our thinking from allopathic, pill for an ill, symptom-based treatments with drugs and surgeries to a more well-rounded approach of what are you eating today? If food is medicine, and the old saying goes, you are what you eat, I like to say you become what you eat, because you are essentially becoming what you eat. So what you see before me is a product of what I have been eating the last 72 hours, the last week. You should be able to start a program and on the following week see some shift in your physique, your image. And if you don't, it could be because there's a functional glitch. Where's that glitch? It could be a dirty liver. It could be dirty kidneys. It could be a dirty spleen. It could be a dirty lymphatic system. And I tell patients all the time, if a person comes in with symptoms, I could take their lymphatics, take them in the back, like if I could pull them out of their body and take them in the back and pop them like a rug, guess what would happen? 15 minutes after I put the lymphatic system back in, they'd be better. Because your trash system, when it's dirty, everything about you feels dirty. Everything about you runs inefficient. Everything about you is in what we call the accelerated aging curve. So when it comes to health and when it comes to well-being, you have to choose to find the underlying cause. So your underlying cause of blood pressure may be food. Another person's underlying cause of blood pressure may be an infection. Somebody else's underlying cause of blood pressure may be a GI issue, or kidneys are backed up and congested. You see, there's multiple angles that we can get into to find where the body's breaking down and what we can do to fix it. So when it comes to health and wellness, we're not just listening to your symptoms. We're going to evaluate your health and figure out where is the body breaking down. Where's that little splinter that is a burr in your saddle, or messing up your health? And if we can get that out of the way, you're going to feel a change. You're going to feel a shift in how your body is performing. And so I get real excited because whether it's digestive issues, or whether it's hormone problems, whether it's migraines, whether it's skin, whether it's sleep, people come in with everything under the sun. Just had a CEO come in just this last month, and interestingly, had a ton of anxiety, overwhelmed with growth in their business and expansion. And it was as if they were the dog that caught the car. They didn't know exactly what to do with what they had their hands on. That happens. And so I would say that at this time, he needed some influence on his health to help him manage the world moving so fast and slow it down, and so he could process it faster and better himself, so the world seemed more manageable. And that's exactly what we did. We found that his sleep, he was only getting 4 hours a night of sleep. Guys, sleep is 50% of your health. And in a functional medicine practice, in the transformational world, we are not going to let you go week after week with low sleep quality. Hours of sleep matter, and if you're not sleeping well, you are not healing well. You get 2 times the amount of growth hormone production for every hour you go to bed before midnight. So early to bed, early to rise makes a man what? Healthy, wealthy, and wise. That's the old Ben Franklin quote we all know. And the truth of the matter is if you are sleeping well through the night, so just because you go to bed doesn't mean that you fall asleep. Maybe you're over there scrolling for 2 hours, or scrolling for an hour. That is not sleep. That's not rest. That's you being stimulated, dopamine overload, to a point where you're pushing your stress management system into action and not letting it cool off and rest and heal and regenerate for you to tackle your day. So that's a huge thing that we want people to grasp hold of. Sleep is imperative. Okay. And so what if your sleep issues is just simply a mineral problem? What if it's an adrenal problem? Well, how does that work? Well, minerals are God's tranquilizers. So we use a lot of mineral restoration products. We use a product in our office called Sleep Force, and another one called calcium and magnesium powder, to help the body shut down appropriately and to get a deep night's sleep. So what if you can't sleep because you have restless legs at night? Don't panic, don't stress, don't worry. You can calm that down. That's just a check engine light that your body is worked up and it hasn't had an opportunity to unwind. What if your mind is racing? We use products to calm the mind, nervine tonics specifically, skullcap, for example, or Damiana or saffron, St. John's, very cooling, calming to the nervous system, and allows the nervous system just to go, oh, that feels nice. And then you take some calcium, and then your body's able to rest well through the night. And so when we listen to the body, we are not forcing the body into submission like a drug. When we listen to the body, we are supporting physiology that allows the body to turn the dials, control the volume, and allow stimulation to ramp up or ramp down accordingly. That's called adaptation. And the better your body is at adaptation, that is called functional wellness. And that's, at the end of the day, what we're trying to do is being well. Functional wellness is not about never being sick, never having a symptom. Come on, that's not realistic. No one gets out of here alive, the best that I can tell. And the body is degenerating, and we are exposed to bugs, and we are exposed to parasites. We do have challenges from metals and chemicals and environmental, plastics and preservatives that are in our food, and we have bad water, and we have issues. I mean, we are putting in food that comes from bad soil. So we can't expect our bodies to run perfect all the time. And so I want to help you see that just because you have a issue in symptom or diagnosis, it doesn't mean you're stuck there and you don't necessarily need a medication to fix it. What we know is if we change your diet, if we support the glitches, those micronutrients, those mineral nutrients, those vitamins, those essential fatty acids, that core 3 that you have to make sure to make every cell function like God created it to function, your body will begin to heal. And when your body begins to heal, your symptoms just go away because adaptation is getting better. Functionally well is a way that, look, when you're in transformation land and you want to be the best CEO you can be, when you want to be the best mom or dad you can be, the best child of the living God you can be, the best friend, the best lover, the best anything, that's transformational. You have to be good at dropping back into the functional management world and understand where and when your body starts breaking down, that you're paying attention. And then you're also paying attention to your stress zone. Are you hitting those spots? And there's a great book, all you should read. It's called Why Zebras Don't Get Ulcers. And the reason zebras don't get ulcers is because they don't have chronically high levels of stress. They have stress, but so it's not that our bodies can't handle it. It's that we aren't supposed to be under chronic stress. And stress drives a lot of these gut problems, and stress drives a lot of our body's rapid degeneration problems, because the more our body is trying to manage stress, you're losing minerals for restoration and regeneration. And so we have to get in there and teach you where your body's breaking down. That's root cause medicine. Okay, and we do that through blood work. We do that through stool tests, hormone tests. We do that through functional listening, just listening to you talk as we ask questions to figure out where your body's faulting. But if you have symptom patterns that you were not genetically born with, you're in luck. We can help you, we can serve you, and we can teach you to be the best version of you each and every day. So God bless you today, guys. I hope that you go out and do everything you're called to do in life in order to be everything that God's called you to. So see you next time. We can't wait to share more good health tips with you. So here on the Dr. Chapa Wellness Show, you're in for a treat.